this is a disease where it's not easy to tell you that this is the pathophysiology and this is the key thing that leads to bladder pain. So similarly in the diet, what I find, next slide please. The bladder and the food connection is not easy to make. When you eat something bad and you tell somebody that you ate and that is why you're having a stomachache, people can understand that. When people tell you that you ate a certain food and you're not feeling good in the bladder area, they think that there's something wrong up here, and they also make it a psychosomatic kind of problem. So it's not a straightforward thing, and this is because there are many pathways which can act on the bladder. And these many pathways, Dr. Tamil Selvi did mention, but I will also again sort of go through it very quickly. But the good thing is, we have many reports about these reactions on the bladder, and food sensitivity is a common problem in bladder pain syndrome patients, and this is on record. And fortunately, we have enough science to back it. We may not have all the answers, but we do have some idea, and that is what I'm going to share with you. Next slide, please. Let me tell you that we tend to view food as just nutrients, which is giving us the sustenance, which gives us carbs, proteins, vitamins, minerals. But food is much more than that. It's a cocktail of chemicals in different proportions in different foods, and there are many bioactive compounds in foods. These bioactive compounds, many of them have properties which protect us from disease, but we need to use them carefully, especially in bladder pain syndrome, so that we are not putting the bladder into an overdrive. So these bioactive chemicals in food are important for us. They prevent disease, but we need to know a little more about them and their relationship with the bladder. Next slide, please. But one very interesting situation that we've seen in the COVID times, that the flare-ups that have come to hospitals with the bladder pain syndrome has markedly increased. And this is not something to do with the virus, but it is something to do with the diet. And I think all of you have guessed what it is. It is the usual concoction of different herbs, etc., that people were having as preventive for COVID. And these had every household had a different kadha preparation. There was no standard preparation. People were putting in as many sort of compounds into it to make it into a kadha, which is potent to protect you against COVID. But what was happening is, because of the overuse of these kadhas, I also know patients who actually stopped eating meals. They were having different kinds of kadhas all through the day, like making it like their meal. So that is why we know that there were more problems regarding flare-up of bladder pain syndrome. Next slide, please. Just to give you an idea about the bioactive compounds in the foods that are present, and especially in the context of bladder pain syndrome. This is one bioactive compound, which is omega-3, which everyone knows. It's a kind of a favorite bioactive compound because of its beneficial properties. And what we see is this is IC friendly. This compound is IC friendly. And where do we find it? We find it in fatty fish. We know that different kinds of fish. In the Western books, you will find the name of cod, tuna, salmon, but these are not available here. So that is why I've written the names of the fatty fish that we can get here and which is easily available: hilsa, katla, surmai, back pomfret. These are all the omega-3 rich fish. But if you are a vegetarian and you want these sources in the diet, where do you get it? You get it from the oils of mustard and soya, which are rich in omega-3. The leaves of palak, rye, mustard, nuts like walnuts, seeds like flax seeds, methi, and the various dals that we use, udad, lobia, rajma. So just to tell you that these bioactive compounds are there for IC-friendly foods which can be included in the diet for anybody who suffers from bladder pain syndrome. Next, please. So like Dr. Tamil Selvi said, that the foods affect the bladder through the 4 pathways that seem to link food and the bladder. We know that the bladder lining is sensitive, the mesengaglier, and the composition of the urine changes with the diet. And what happens? This urine comes in contact with the sensitive lining, and that is how the reaction happens. The next kind of pathway is the pain receptors are increased, and therefore nerve sensitivity is increased. And when food is digested, it's metabolized. So these food metabolites come in contact and they activate these nerve endings, and then the bladder reaction happens. The third one is the mast cells are increased, and the allergic reaction of the food again cause that increased histamine flow, and again inflammation happens. Next slide, please. So these were the 3. And the 4th important one is all the organs are connected together, but the connection between the bladder and the gut is a strong one. The gut is strongly connected to the bladder. That is why you see the overlap that you find in IBS, constipation, celiac disease with bladder pain syndrome. So the crosstalk that happens between organs. So if there is a pain in the gut, it radiates to the bladder. So that is why this overlap is important, and we need to understand this. So the food bladder connection is made by these 4 pathways, and these are in play. What happens is, next slide, please. We have to see for every individual, for every patient, what is that pathway which is hurting that person, and what is that food which is hurting that patient. And we have whether it's the allergic reaction to the food, or whether it's the pH of the urine which is changed with the diet, or increased solutes in the urine, whether it is the potassium content of the urine which is bothering, and that food is affecting that person. So in common, what we see, there is an inflammatory process which begins due to this reaction of the food on the bladder, and this inflammatory process causes the problem of pain, frequency, urgency, which the patient may experience. Next. Hippocrates, very wise person, 2,500 years ago, said something which we know is even true today. He said all diseases begin in the gut. And more, what we are realizing is we need to not only pay attention to what we eat in terms of nutrients and bioactive compounds, but when you eat, the timings, the chrononutrition is getting just as important, and how you eat, that mental state in which you're eating. So all of this is important. And the organ within the gut is again a very important thing, which may cause tilt in favor of inflammation, pro-inflammation, or anti-inflammation. And that organ is the gut microbiota, or the intestinal flora, which can increase inflammation or decrease inflammation. So that is why it is called a very important organ residing within an organ. Next one, please. So we can see the link between the diet, the gut flora, and the inflammatory process. And once inflammation starts, it is the building block for many diseases and many chronic diseases. And actually, till now, 25 diseases have been linked to the gut flora imbalance. So if the imbalance is towards the bad bacteria which cause inflammation, you know what will happen. So we have to pay attention to the gut flora. That means we have to pay attention to our diet and to our lifestyle. And there are interventions which are done to make sure that this inflammatory process is kept down and kept as low as possible. And such interventions are probiotics and prebiotics, which are present in food, as well as you can take supplements for getting these in the right quantities. Next, please. So like I said, that We know we have many parts of the puzzle which are sort of falling in place, and yes, diet does matter because we have the evidence, we have the science, and there is a book which I have written with my mentor, Dr. Rajesh Taneja. He introduced me to these patients and I saw their suffering and I thought I should make this task a little easier for them, and which is why I hope all of you who could refer your patients to read this book and make it a simpler task of finding the connection between the food and the diet, the food and the bladder pain. Next, please. So when you talk about diet, the first thing that needs to be done, the foundation, is mindful eating. When you're eating, you have to chew your food well, no matter what your diet is. It should be a diet which needs chewing, because we have been granted these teeth, because the diet needs to be chewed. We should chew every bite. And if I tell you that the recommendation is to chew every bite 40 times, you'll think that I have lost it. But the actual recommendation is that we need to chew every bite of food. But even if you don't chew it 40 times, chew it at least a few times. And in the IC diet, what I find is planning beforehand, not just the meals, but the snacks is very important. We should be knowing what is allowed and what is not allowed. And so that planning helps to sort of relieve that stress that comes from not knowing what is allowed and what is not allowed. And as far as possible, minimize junk food. Junk food is that food which does not have nutrition present in it, or minimal nutrition present in it. So this is what you have to do. And if you take care of the planning, you can make sure you can have foods which are easily available, and you can stick to a budget which is for the diet. So you don't have to go over and beyond it. And it's very, very possible. Next, please. The main feature of the IC bladder pain syndrome diet is it's an overall nourishing diet. And it's not a diet where you have to eliminate a particular food group and you're going to be deprived of that. There are many choices available, and there are plenty of nutrients, phytonutrients, which I talked about, the bioactive compounds, which are protective and prevent disease. And food can be made tasty and it can be enjoyed. Like I told you that we can have fatty fish, many of the fats are also allowed, and it's probably a myth that people have that you cannot have fats if you have IC-BPS. Next. When I talk about diet, the most important component of the diet is water. So I need to spend like 2 minutes on this important component. And it's very important to maintain hydration. But I know that many of my patients have this fear of pain, frequency, urgency, and they sort of cut down on their water intake and their hydration is not maintained. But this is detrimental, it's counterproductive. And what happens, the urine becomes concentrated, and the concentration hits the bladder and causes pain, more pain. So what you need to tell your patients is don't have large quantities of water in one go, but you need to have smaller quantities more frequently, and include water-loaded foods in the meal. Like supposing you're having, say, a loki or a bottle gourd. Don't overcook it and sort of make it dehydrated so that none of its water remains. Let the water remain, and that water will be helpful and it will help to maintain hydration. So when you're cooking, don't dehydrate foods too much. Let the natural water in the foods remain. And you yourself as a patient need to keep a check on the color of the urine. And if it is light straw color, pale color, you're doing good. And if it is darker, you need to increase your hydration, and you should have more frequent water intakes. You don't have to have a lot at a time. Next. So you need to have a diet which is healing. And the most important step in planning this diet is you have to start with the elimination diet. Everywhere, whether it's on the internet or books, you'll find a set of foods which are taboo for ICBPS. Those are generalized things. You need to find out what is good or bad for your patient or for yourself, whoever needs to have this diet. So logging of foods and the symptoms are crucial. And in my book, I've written how to maintain that log of food symptoms and do it carefully. And if you do it carefully initially, I think it takes care of lots of problems later on. So the idea is to include all the things that are good for you and only exclude the offenders, the particular foods which are offending. And what I find is home cooking is usually safe because you're not using too many preservatives and too many chemicals. I'm not saying all chemicals are bad, but we probably don't know enough about them, and we also don't know how they will react in individuals. So if you want to start off food without too many chemicals, which is fresh, and I'm often asked if frozen foods are okay. Yes, fresh is good, frozen is also okay, because most of the frozen foods don't come with chemicals. They are just packed in such a way that they don't have added chemicals, and those are fine. So when they're processed foods, you have a whole list, a label to read, and you have to see. So initially, I would suggest that when you're starting the elimination diet, go for home cooked and fresh foods or frozen foods. And then as you graduate, you learn more, you can go on to other foods. Next, please. So there are many myths which need to be dispelled. And like I said, it's not a deprivation diet. And many times I'm asked whether if I'm not allowed coffee, can I have decaffeinated coffee? Coffee is not just caffeine. It has so many other chemicals in it, whether it is the acid which can increase and hit your bladder, we're not very sure. So even decaffeinated coffee, when you're trying to do the elimination diet, keep that out, and then gradually we can see whether coffee is okay for you or not. And like I mentioned, fats and oils are not taboo. You can have the normal amount of fats and oils, have the ones which are anti-inflammatory, have those fats, those are recommended. And the bottom line is, don't think that just because so and so said that this food is bad, this is not to be had by any IC patient, and that is taboo for you. That is not true. You have to find your own foods which are good for you and bad for you. So next slide, please. Just to give you an example, many times the patients ask me that so many of the vitamin C rich foods are excluded from my diet. I don't get to eat, I don't get to drink orange juice, I don't get to drink tomato juice, I don't get tomatoes. So how do I get my vitamin C? Do I have to take a supplement? So I want to tell you that many of these leaves that I've written, I hope you can see them, the amaranth, the cholai, the methi, the colocasia leaf, the arvi leaf, drumstick or moringa, radish leaf, spinach, cabbage, all of these are rich in two very important nutrients for bladder pain syndrome, which is folate and vitamin C. And more data is coming about folates, and it is an important part of the diet. So if you can't have, say, orange juice, there are other things that you can have. So it's important to know what are the other things that you can substitute with. Next, please. So fine tuning is what is required in any ICBPS diet. So you are like on an exploration project. You find the foods, and it's not just the foods, it's the quantity. And many times I find that if I say to a family that you can have one small tomato which goes into making a sabzi, that works well for the patient. So that small quantity is okay. So it's not like tomato can never be had by an IC patient. It's also about the food and the quantity and knowing about the different brands. Same product, different brands have different compositions. So maintaining a food diary, writing down the brand that you've had will help to identify the culprits. And it's not just the diet, but also the state of the mind, the sleep, the medication, the physical activities. Each of these is important when you're fine tuning the bladder pain syndrome diet. Next, please. So dietary modifications are required, but it's totally doable because we just need to find out which is the food component and which are the different pathways which are affecting that patient and which is which is the offender, and then make it a unique diet for you and make it unique and make strategic changes. And just a word here to tell you that there could be even healthy foods, like I talked about the kadas. I know of a patient who was started having lots of cups of green tea, and suddenly that affected her bladder. So it's not that a healthy food cannot affect your bladder. So it's a unique thing which you need to understand, which affects your bladder. Next, please. So customization is the answer. And of course, logging all that you need to log very correctly. And I end with, again, something that Hippocrates says. And he said that if you give every individual the right amount of nourishment and exercise, not too much and not too little, you found the safest way to health. And I think that's so true and so relevant even today. And even in the case of bladder pain syndrome, we just need to customize and do that fine tuning to give the patients of bladder pain syndrome the relief that they want. So thank you so much for your patient listening. Thank you.